everyone, beautiful people. Welcome back to my YouTube channel. This is Nothing with Annie on your screen. If you're a returning subscriber, thank you for coming back. If you're a new subscriber, welcome to the family. I am welcoming you with open arms, like my arms are wide open to welcome you. So you're welcome to the family. This is Nothing with Annie. This is my YouTube channel where I film about nursing, health, lifestyle, faith, everything that will benefit you. If you're a student nurse, if you're a nurse, if you're planning to go into nursing, so this is a channel you want to subscribe to. You want to turn on your notification bells to get notified when I post a new video. You're not going to regret clicking on this channel or opening this video to watch. So yeah, give this video a like. If you finish watching the video to the end, give it a comment, drop a comment, your review on how the video was or is for you. So you're welcome. On today's video, I'll be dropping, I'll be explaining to you some common terms that are used when it comes to asking essay questions in exam. Some common terms that you'll be seeing along the line when you're about to write your exams, and I want you to get acquainted with these common terms so that when you see them in exam, you'll be able to use it to the fullest, and for you to get your full marks. Because in nursing, to get half mark, you know what you do before you get half mark, not talk of 1 mark, not talk of 2 marks. So in order for you to get your full marks when you answer questions in exam, because sometimes you answer questions in exam, you feel you answered it right, good, fine, what you answered is right, but you might not really get the full mark that was allocated to the question. And then when your result is out, you see your score, you'll be like, but I know this thing very well, I answered it very well, so why am I getting a score below my expectation? So this is what I'll be revealing to you in this video, in order for you to stay checked, and in order for you to know how to go about it when you see these terms in your exam, so that you'll be able to write properly and get your full marks. So stay with me and don't go anywhere. So a common term that is used in asking essay question is list, state, give. When it comes to these terms, list, state, give, from the word or from the term, you already know that you have to go straight to your answers. You already know that you're not supposed to beat around the bush. You already know you have to hit the nail on the head. This kind of term, when it's being used, it calls for recall. It helps you know how much you can recall something very fast. It helps you know how much you can recall an answer to a question. For example, they say list the bones in the body, list the type of nursing equipment, list the type of nursing procedures, they'll just tell you list, give, state. They require you to just go straight to the point. Don't beat about the bush. Don't start explaining where you are from. Don't start explaining where you come from. Don't start explaining, just hit the nail on the head. That's what I'm trying to say. Go straight to your answers to avoid wasting your time, to avoid writing too much that at the end of the day it's still that mark that they want to give you, or that is being allocated to the question that will still be given to you. In order for you not to waste your answer booklet or answer sheet, just hit the nail on the head, go straight to the point. And you also have write briefly or write a short note. When it comes to write briefly or write a short note, the short there already tells you what the examiner wants. Like, when it comes to exam questions, write briefly or write a short note. It could be about a particular topic or a subject, a topic in nursing, and okay, let's take one of these diseases in primary health care. I don't know why I'm using primary health care. Why one of these diseases in primary health care, like something like ascaris, or something like chickenpox, or something like diarrhea, or something like measles, and they say write briefly or write a short note on this. So what you're expected to do, you just write a short note, write everything you know about that particular topic, but in a very short way. You don't need to fill your paper, you don't need to ask for extra sheets when it comes to that. Just write a short note. You can use headings to be a guideline. For example, the name, the course, the courses, the signs and symptoms, the prevention and treatment. Just use headings to be your guideline, and you just bullet it. Just give the important thing you feel should be given. For your examiner to know that you actually know what you are doing. Not when they say write a short note, you now go and write essay. You write more than 250. You write more than 250 words. You want to fill your paper so that you can collect extra sheets in the exam hall. Please and please, these things can reduce your mark. And taking details of what I'm saying can either reduce your mark or increase your mark. So it depends on which one you want. Do you want your allocated marks to be given to you in full, or do you want the marks to be decreased? So you should try and note these things so that when it comes to examination, you are not confused and you don't give more than what you're expected to give. Yes, I know they will say give them assignments, but when you are giving assignments, be very careful not to go and give the kind of assignment that will not land you on, getting a very low score in exams. So that's what I'm trying to say. Then another is, what is or explain. This is an open-ended question. You are meant to give full details about what you know. Your answer to the question is dependent on the knowledge you have about the question. So you are meant to just explain in full details everything you know about a particular question. For example, they say explain the process of blood clotting. Every single thing you know about blood clotting, every details you know about blood clotting, every knowledge you have pertaining that question, you write it. No matter how long, no matter how, just give your detailed explanation. How well do you know that thing? That is what they are trying to find out from you. So if they say explain, make sure you explain. Don't just write 1 line, 2 lines. Don't just write the definition of what the question might be. Explain, write the definition. If there are signs and symptoms, you write. Especially when it comes to disease condition, if you are testing a disease condition, write, define that disease condition, write the signs and symptoms, write the causes, write the risk factor, write the treatment, write the complications, every single thing you know about that particular disease, and you are told to explain. Write everything you know in order to get your full mark. Then you also have define. Define means just saying what it means. For example, when they use define as a term in your questions during exam, for example, define primary health care, for example, just define it, like give it verbatim, especially when it's something that is being defined by a body or an organization. Like I said, when you're asked define primary health care, you know that WHO has defined primary health care, and in exams that is what they are. Okay, in the cases where they say define, so according to, so you're expected to give verbatim. Don't put your own words, don't define it in your own words. But in situations where you are giving questions to define and they did not state who you should define the question according to maybe a body or an organization, just define, just give the meaning of that particular question. Just say what you know about that particular question, define it, and that is it. You are not required to do anything more or anything less. The last one I want to talk about is discourse. When it comes to discourse, you are also required to give detailed, because it's just like a discussion. You answer that question like you are discussing. You have to give full details about the particular topic, or about the particular topic you are discussing. So it has to be detailed. It has to be like a discussion. Say every single thing you know about that particular topic, so you can get your marks in full. Just explain in your own words. Discuss it just like a discussion. Discuss it in your own words. How well do you understand this topic? It's one thing to know a topic, it's another thing to understand. Like, discussion now means, for example, if it's not in an examination setting, maybe you are in a group reading and you are given topics to go and read, so that when you come back to the group reading, you have to discuss it with your group members. So when you're given that topic and you go and read about it, you have to, break it down into fragments, so that when you come back to the group to discuss it with your group members, you are able to say it in a way that they can relate with you. So that's the same thing that you are doing in an exam. You are discussing a topic in a way that the examiner can relate, in a way that the examiner can see that, okay, you really understand what this topic means. And exam is the test of knowledge, even though they say it's not the true test, but to an extent it's the test of knowledge. So if you are able to discuss, when they tell you to discuss in an exam, discuss it in the way that your examiner or whoever is marking your script can relate to what you're saying, and the examiner will know that you are not just giving verbatim, you are writing that particular, you are answering that particular question in the way you understand. So that is it. I've come to the end of this video. I didn't want to make this video long, but these are the common terms I've noticed these are the common terms I've noticed that they use, when it comes to exams, especially in nursing school. These are the common terms they use to, trick us and make us feel like we know what we are doing. Meanwhile, they themselves, the people who said the questions actually know what they're doing too. So it's good for you to be familiar with these things, so that when it comes to examination, you are not confused, you are not moved by the way they come with their questions, you are not moved by the way they ask the questions. You already know that this is what they want, because sometimes in examination, the way they will ask the question will even make you forget what you already know, or you will know a particular question, but because of the way the question was asked, you might and start answering rubbish or answering it in a different way. So it's good that you are conversant with these common terms, so that when it comes to examination, you are able to answer the questions the way they want you to answer it. So I've come to the end of this video. If you enjoyed this video, click a thumbs up, like this video, comment, and share this video to your friends, family, loved ones, to anyone you know that is in nursing school, to any nursing student someone who wants to enter nursing, so that they will also know these things and they will not be ignorant. So thank you for watching up to this moment. Remember to subscribe if you're not. I can't wait to have you in my space, in this family, So please subscribe, share this video, like, comment, and I will see you in the next one. Bye.